Difference between worry and rumination. The distinction between worry and rumination lies in the focus of repetitive negative thoughts. Worry involves concerns about potential future negative events, while rumination revolves around negative thoughts regarding present or past difficulties, their causes, consequences, or the discrepancy between desired and actual life circumstances. In summary, worry pertains to future threats, whereas rumination focuses on present, past events. For instance, a person experiencing depression may ruminate on the reasons behind their lack of motivation, such as laziness or past failures. On the other hand, they might worry about upcoming events like a meeting, exam, or doctor's appointment. Despite these differences, both worry and rumination share common characteristics. They are both characterized by negative, repetitive, and uncontrollable thoughts. Additionally, they are associated with mental illnesses, with worry being prevalent in anxiety disorders and rumination more common in mood disorders like depression. Research also links rumination to negative mood and feelings of loneliness. Causes of repetitive negative thinking. Why do we engage in worry and rumination, and what benefits do we perceive from them? Negative repetitive thinking tends to serve two purposes: decrease the likelihood of experiencing sharp negative emotional contrasts, increase the chances of experiencing positive emotional contrasts. To illustrate, if someone had been feeling apprehensive and worried about the possibility of losing their job, receiving the news that they are indeed laid off might be less distressing. The emotional contrast between their feelings before and after the news is minimized. Conversely, if the news is positive and their job is secure, the positive emotional contrast would be more significant. However, if the person was already in a positive emotional state, the news might not have a substantial impact. These ideas form a theoretical framework, and the following study aims to test these assumptions and explore how worry and rumination affect emotional contrasts. Investigating the uses of worry and rumination in depression and generalized anxiety disorder sample. The study involved 63 participants, with 48 females and an average age of 19. The racial breakdown was 60% white, 15% Hispanic, Latino, 15% African American, 8% Asian, Asian American, and 2% multiracial. Out of the 63 participants, 37 had major depressive disorder, MDD, and/or generalized anxiety disorder, GAD, while the remaining served as healthy controls. Measures. The researchers employed various assessments, including the Generalized Anxiety Disorder Questionnaire IV, Beck's Depression Inventory 2, the Diagnostic Interview for DSM-5 Anxiety, Mood, and Obsessive-Compulsive and Related Disorders, and the Ecological Momentary Assessment, EMA, measure. Results as anticipated, both worry and rumination led to increased sadness and anxiety while reducing happiness. They were also associated with diminished negative emotional contrasts. In other words, higher levels of worry and rumination hindered significant emotional shifts by limiting the increase in negative emotions and the decrease in positive emotions. The data revealed that individuals with anxiety, depression, compared to healthy controls, encountered more negative events, perceived these events as more unpleasant, and engaged in more worry and rumination, possibly due to heightened sensitivity. Notably, those with anxiety, depression preferred transient positive emotions rather than sustained ones because prolonged happiness and relaxation made them feel vulnerable. To avoid prolonged positive mood states, they resorted to worry and rumination. This finding supports the author's theory, suggesting that individuals with anxiety tend to desire short-lived positive emotions. Although they appreciate happiness, joy, excitement, or satisfaction, they prefer these states to be fleeting. Spending more time in a state of happiness and relaxation heightens their awareness of the potential for sudden mood shifts towards negativity, thereby increasing their anxiety. Takeaway: both rumination and worry diminish positive emotions and amplify negative emotions. People employ rumination and worry as coping mechanisms for two main reasons: to evade sharp negative emotional contrasts, preparing themselves emotionally in case something terrible happens. to avoid sustained positive mood, since allowing oneself to feel happy leaves them vulnerable to subsequent negative emotions. So, how can individuals engage in more adaptive and healthier strategies for coping with anxiety and depression?